This summer, we're bringing you a series of health-related events called Healthy You. I'm going to tell you about those events as well as some health-related resources here at the Public Library tonight. First, I'm going to introduce tonight's 6 to 6 with just a little bit of background about health literacy initiatives at the library. So this summer's Healthy You programs are made possible with support from the Healthcare Foundation of Porte. They recognize that because 20% of questions at the library help desk are related to health and wellness, that they supported our programming this summer and resources at the library. So this summer, when you attend a Healthy You event, you will receive a water bottle and a beach ball, as well as be entered to win a kayak or a bike. And every time you attend an event, you'll be entered to win one of those. So starting tomorrow with yoga at the library at 10 a.m., and I'll tell you about that in a second. Attend that event and you'll be entered. And next Wednesday and next Wednesday and next Wednesday, and you'll have 4 entries. And you'll be 4 times as likely to win as that goes. So let me tell you a bit about those Healthy You events. Of course, let's start with yoga at the library. Tomorrow, June 17th, we'll have our first yoga at the library. They are every Wednesday in June and July, except for July 8th. And those will be easy to understand, easy to access, 45-minute yoga classes for all skill levels. So come and enjoy that tomorrow in the library's Predlawn. It's the corner of Harrison and Madison, right here in LaPorte at 904 Lincoln Way. So that'll be our first one. Next week, we'll have our first Healthy You event related to walking. It's called Walk with a Doc. These programs involve, they're gonna be so much fun. Yesterday, I tried the Chessie Trail for the first time and it is fantastic. So if you haven't done that, this program is going to be the best way to enjoy that because you'll be entered to win a bike or a kayak. So what is Healthy? What is Walk with a Doc? Walk with a Doc is a nationally recognized initiative where local doctors will come and present quickly on a health topic. I know next week's nurse practitioner, who's also a professor at PNW, will be speaking about the benefits of activity and just not having an inactive lifestyle. So many things in today's world, it's so easy to just sit all day. So even just parking further away from the grocery store, going up the stairs instead of taking the elevator, all those basic things. We'll talk about those next week as we enjoy our first walk at Chessie Trail. And where can you find us for that event? So that event will be held on the Chessie Trail at Truesdale Avenue. So if you were driving from Pine Lake Avenue to Clear Lake, that little bit of a turn, you'll go over that green crosswalk. That is the parking lot we'll be meeting at, and the doctor will speak there. We'll do about a 10 to 15 minute walk down to Rumley Pond from there. There's some nice benches. That'll be our turning around point. Feel free to continue all the way down to Kiwanis Park though, if you so choose. Absolutely stunning trail. You absolutely have to try it out. So that is Walk with a Doc, and I'll show you where you can find those events really quick. So I'm gonna screen share. So on the library's website, you're able to go to events. And then event type, health and wellness. And that'll take you to all the Healthy You events. And any of those Healthy You events will enter you into winning the bike or kayak. So this week, let's change the range date to show this whole week. So you can see that we've got yoga at the library tomorrow morning at 10 a.m. And if you have any questions about these events or other events at the library, just give us a call at 219-362-6156, and any of the librarians will be more than happy to help explain some of these events and which ones qualify for the raffle. So I can stop sharing my screen. We have other Healthy You events being planned that I am excited to announce in the future, so look out for those. So for the other half of this six tips at 6, I'd like to tell you about some health resources here at the library. And right away, I want to start with the help desk. Whenever you have a health question, many people respond to those. There's so much information coming to you, and at the same time, so little information. So sometimes people come to the help desk and they ask questions about, like, my doctor just said I was diagnosed with this, and what does that even mean? And maybe they completely misunderstood the doctor, because I know your heart can get going in that doctor's office and you just need something nice to read afterwards, something easy to read. And we can help you find that. I was talking to a coworker today about a traumatic experience that I had when I was studying abroad, where a doctor diagnosed me with a very common, like, bacterial infection. Everybody just has them. But they explained it as svinkoper, which is the Swedish word for swinepox. So we go and we look up swinepox in English, which is an incredibly deadly disease. So that heart attack I was having, where I thought I was going to die of swinepox, was just simply unrealistic. And a good librarian would have stopped me and told me that, no, you just need to look it up with the actual word, and take your antibiotics twice a day for 2 days and you'll be fine. It was so easy. And I didn't die of swinepox. So of course, when you come to the library and ask for help finding helpful information at the help desk, please be aware that the librarian who is providing you information is only providing you information. It does not substitute for the advice of a healthcare provider. So listen to what your doctor says, and be aware that any information that we give you is not medical advice. It is simply quality information that we have found from resources. So let me show you those resources. Let's do another screen share. So from the library's homepage, we're going to go to Library Online, and I'm going to show you a medical encyclopedia that many people use. A lot of people use WebMD, or even just go to Wikipedia. I know that's where I went when I was having that terrible misdiagnosis. But from the library's homepage, we're going to go to Research, and then we're going to scroll down to Health and Wellness. And then these are sorted alphabetically, and I am just going to show you this one is a popular resource that I'm not talking about today, because I'm talking about MedlinePlus, which is a fantastic resource from the National Library of Medicine. I don't know about you guys, but I have been learning all kinds of things about federal agencies related to health recently. So of course, we've all heard of the CDC, and you've probably heard of the National Institutes of Health. So there's, I believe, 28 institutes of health, and one of them is the US National Library of Medicine. And they recognized that many people have a hard time finding information that's quality and up to date and authoritative. And so the doctors at this organization came up with this encyclopedia that's available online for free. So let's look at a couple things on here right away. Maybe your doctor ordered a different test than usual. You can come find out more about that test. We'll go into the medical encyclopedia in just a few minutes. Healthy recipes could be fun, but it's much too close to dinner for me to look at that. Drugs and supplements, maybe you feel like you need to start taking more vitamin D in the winter. Learn more about that here. Talk to your doctor about it. Video and tools. Let's go look at health topics really quick. So disorders and conditions, diagnosis, therapy, demographic groups, health and wellness, all kinds of topics here. One of the ones that I find interesting is that maybe your preteen became a teen and now you need to re-up your knowledge base on, like, what does it mean to have a teenager. Older adults, that's a health topic that I have all the time here at the library. So maybe your mom just was diagnosed with dementia and you need to learn about what dementia is. Or maybe you're worried that she's showing pre-dementia symptoms. So we could go here, we could look at dementia, all kinds of helpful information. But today I want to use HIV prevention as our go-to example. So if you need any help finding MedlinePlus, just contact us here at the library. It's super easy. You can also Google it. But yes, so today I want to also talk, and to finish off the 6 tips at 6, with just a few tips on how to identify quality information online. And to do that, I'm going to be comparing 2 very similar pages. One is from MedlinePlus and the National Institute of Health. And sometimes we'll get moved over to a different website created by the National Institute of Health, or another very authoritative, like if we website, if we were looking up cancer, we might get sent to cancer.org. And then we'll compare that to the WebMD article about HIV prevention. So really quick, let's look at MedlinePlus and then compare it to WebMD. Right off the bat, you'll notice that there's no information, there's no advertisements. So it's created by the government. The government's not going to advertise for anybody. So we can find authoritative information. There's it's available in Spanish. Scrolling down, there's a quick summary. Talks a bit about all kinds of things. And just once again, the information that you receive at the library or from the help desk specifically does not imply medical recommendation. This information from these sources is intended for general information and should not be used to supplement the advice of a healthcare professional. So there's a few questions that I think everybody should ask when they go to an article. Right off the bat is who wrote it, when did they write it, and why did they write it? So let's look at that on these. So we know that the National Institutes of Health created this article and they wrote it. If you scroll to the bottom, you'll typically find how relevant and up to date it is. So this topic was last reviewed November 26th of 2019, which is pretty up to date. Like for this condition, you wouldn't want this information to be much more than 5 years old. You definitely wouldn't want it to be from the 90s or the 80s. That would be a complete other world. Let's compare it to WebMD, excuse me. So right away, we can see that there's advertisements on here. And you kind of ask yourself, like, who's advertising to whom? Why do they expect me to be here? Let's see what the advertisements are. They're loading. Yep, still more advertisements for people who are living with HIV rather than people who are treating or preventing it. Well, I guess treatment and prevention. I'm getting lost in the weeds. So let's go find how old this information is, who made it. I'm not finding anything. Preventing HIV, let's go there. So another question we'll ask ourselves is this information relevant to the library user? And you've seen me answer that question a few times on WebMD. It has not been relevant to the library user. So let's pretend a mom came into the library and her gay son is, she's worried that she just wants to have this information. She wants to be sure that she knows it so that he knows it. Yeah, because more than 1 in 5 young adults between 18 and 35 are concerned that they're at risk for HIV. So it's information for everybody to have. And those last 2 pages, we're not providing it. So, goodness, there's so many ads. You can learn about a mattress here. You can learn about Kroger pickup. But what I want to know is when this article was written, January 15th, and it was written by a medical professional. So let's compare that back to MedlinePlus. MedlinePlus was written in, that's right, November of 2019. So still not from 1995. So they're both pretty current. One's a bit more authoritative because it's from the National Institute of Health as opposed to WebMD. and that one doctor. We don't know who that doctor is. We could look at him up, Google it a bit more. So what are some other questions people should ask themselves? Is it relevant? We have a hard time finding relevant information on WebMD. Is it current? They're both very current. Is it authoritative? I would definitely say that WebMD is more authoritative because it comes from the National Library of Medicine. You can also click through and see some more information here. Let's see where some of these links go. So if you wanted to learn about post-exposure prophylaxis, you might end up on this AIDS info, which is from the National Institute of Health. All About PrEP is a video, so maybe the mom wants to just send her kid a video. She knows she's not going to read it, but she will watch a video. So you can come in and ask for a video about a health topic specifically, and we will help you find it. All kinds of great information from the National Library of Medicine, American Social Health Association, Black AIDS Institute. Very relevant, as opposed to most of the information on this page. If the mother was trying to prevent HIV and she's getting all these ads about HIV treatment, that's just not helpful. It's not relevant. Kroger is not relevant. Who knows what this ad's about? Accuracy. Both of them provide pretty accurate information, except, and I'm very concerned about this, if a mother came in and she was asking about preventing HIV and she was seeing all these ads for this medicine, while also learning about PrEP or post-exposure prophylaxis, it would be very confusing for her because she would see Sumantuza and then she would see PrEP, which, have we even seen that on this page? PrEP is a medicine that prevents HIV, and it's just a family of medicines. Protect yourself with PrEP. There we go. And it stands for pre-exposure prophylaxis. Yeah. So the accuracy is much higher on MedlinePlus because it's not trying to sell you medicine. And of course, that speaks to the purpose. So as you can see, there's a lot of benefits to using MedlinePlus to using other medical encyclopedias on the internet. Many of those other encyclopedias are trying to sell you ad space, and they exist in order to do so. However, MedlinePlus exists to provide easy to access information to people of all language and reading levels. And of course, you can come into the library and ask for information at the help desk. We will provide general information to improve your understanding of health, but it does not substitute for consultation with a healthcare provider. So just really quick to recap the information that I've covered today. You can come to the Healthy You series at the LaPorte County Public Library starting tomorrow, June 17th, and enjoy yoga at the library, where Sarah Hott will be providing accessible yoga for all skill levels. That's tomorrow at 10, and if you attend that anytime, any Wednesday for the next 2 months, you'll be entered to win a bike or a kayak. And you can see those here at the library. They're on display by the DVDs or by the book drop. It's really fun having a bike and a kayak inside the library. And like I said, next week we'll have Walk with the Doc. That is Tuesday at 8 a.m. at Chessie Trail, where it intersects with Truesdale Avenue. So more information about that on the library's website. And then keep your eyes out for some really cool events that we have planned for July. And you'll hear more about this, of course, when you come to the Walk with the Doc or yoga at the library. So that's all I have for you guys tonight. Thank you for tuning in and for watching and for learning more about some medical resources here at the LaPorte County Public Library. Thank you. Bye-bye.